All right. Thank you so much for joining us, and welcome to our parent panel. We are going to get started in just a second. I am really excited that you're joining us, and thank you again for signing up for this parent panel discussion with LSA, with Life Services Alternatives. I'm Hadia, and this is a part of a larger parent webinar series that we're going to be doing throughout this week. So we have a few different talks happening. I invite you to go to our website at lsahomes.org to sign up for those other talks. We will go more in depth into things that parents talk about in terms of their transition for their loved one or son or daughter with a developmental disability. So we'll go ahead and get started. I do want to, before we start, want to ask you a quick question. And I have this feature set up for us today. Just want to ask a quick poll about how you heard about this particular webinar, and also what you were hoping to learn today. So tell us a little bit about that, and I'll give a few seconds. After you're done, you do want to click that submit button when you make that answer both of those questions. But we want to learn a little bit more about you and how you heard about us. All right. Almost everybody's responded. Just a few more seconds here. All right. Right. Thank you so much for your participation in that poll. I'm going to give just a few more seconds and I'll move on. It's like we have one or two people who are giving in, and thanks so much. All right. Throughout this webinar, we are going to have opportunity for your interactivity. And we're looking forward to hearing from you. At the end of this 30-minute panel, we'll have a Q&A session. I encourage you to put your questions in the Q&A. It's the best way for us to filter through any noise that's in the chat and to see pertinent questions. Also, for the panelists to see what you're asking and to be able to address those questions. I'll be asking the panelists your pressing questions. And of course, you can always use the chat feature if you need some sort of assistance or want us to respond to you privately. So that being said, again, very excited to have you here today. And please look forward towards the back half of this webinar being a Q&A session just for you. We have some pre-screened questions that we have for our panelists, and I'd like to introduce them right now. First, we have Susan Loritz, who's going to be joining us, and she's almost 20 years at LSA as an employee, a program director, and many other things for our organization. So happy that she's going to be joining us today, talking from the program director side at LSA and seeing all of our LSA homes, how they've grown and we've expanded over the years. And Jill Escher, who is a past president of Autism Society San Francisco Bay Area, and a housing provider and a parent. And we're excited to have her join us for this panel discussion today, and as well as Tina Underwood, who also has a son at one of our LSA homes, and she's going to be sharing her experience with LSA, but also just as far as her process and what happened when she found the forever home for her son, Kevin, which we're happy to have all three of them here with us today and sharing their experience. And I think first I'd like to just jump in and talk a little bit about the types of housing. I think you can't talk about these types of things without putting yourself first in a position of understanding the types of options that are out there. I think that's very important. And so I guess my first question to you, Jill, would be what types of housing are out there? Can you maybe go over that for us and help us understand?
Yeah, I have a couple slides. All right, so I'm going to go over 10 types of housing for adults with autism and intellectual disabilities. So I just have 2 slides, 5 on each slide. I'm sorry, please ignore the typographical weirdness here. That happened when I transmitted the file, but it's all supposed to be like the same font, the same font size. So ignore that. But people who are, parents especially who are, dealing with adults with autism are often completely mystified, or IDD, are often very mystified about what are even the options out there. And nothing I say here is going to be prescriptive, and I have no personal advice for anyone, but this is just 10 things that you should have in mind as you move forward. Now, the first one is something that's not very realistic, but this was the classical paradigm for housing adults with developmental disabilities, which were state-operated developmental centers. Those of you, as you probably know, have been shutting down around the state over the past decades. Here in Silicon Valley, Ag News Developmental Center, for example, shut down, and all of the residents were moved into community placements, places like an LSA, licensed home. There are still 2 developmental centers that are run by the state, and also some crisis homes. ICFs can be privately run or publicly run. They're intermediate care facilities, somewhere between hospitalization and a home setting. And those are usually somewhat larger licensed facilities that feature a comprehensive model of care. Medi-Cal, which is our state's version of the Medicaid program, pays for those. People ask me, where are all the ICFs? And I'm like, I don't know. I haven't seen a list of them in California. I know that they are disfavored among activists and disfavored among regional centers, but nevertheless, they remain a very important alternative. And under federal law, you actually have an entitlement to place your adult with a developmental disability in an ICF. The problem is you have no say where that ICF might be. So sometimes we see people going to ICFs 2 states away or whatever. Third, community care facilities. Well, this is basically where LSA comes in. These are licensed residential homes. This is a very common form of housing for adults. They come on with different service levels, to being the lowest in our particular system, 4I being the highest. That means that they're dealing with more complex behavioral challenges and usually higher staffing ratios as a consequence. There are also enhanced behavior support homes, which have been around now for several years and really came about really as a consequence of the autism explosion and the need for homes that address the complex behaviors and challenges of people who are more profoundly affected. There are also, well, no, I'll save it for the next one, sorry. And again, with those, regional centers pay. As I always tell people, if you get a good placement in one of these, it is like winning the lottery. It is better than winning the lottery. These placements can be very hard to come by. The demand far outstrips supply. Family home agencies is a lot like a community care facility. It's adult foster care, but if you go to these places, it looks very much like a group home, feels like a group home. It's run a little bit different. There's a family teaching model here in Silicon Valley run by California Community Opportunities, I think it stands for. And there are agencies that will actually find a family, train a family, and a person will move in with that family, just like adult foster care. So there are different varieties under this umbrella. A very cool fact is that staff do not pay income taxes when they are in this particular model. That's because of a particular federal law, and that is a really cool thing that I wish applied across the board. Again, regional centers pay for this model. Fifth, a community home or apartment with regional center funded supports. These usually come in 2 variants, maybe 3. Supported living services are usually wraparound services where people actually sleep in the home, the staff sleeps in the home and serves the individual. Independent living services, usually the staff does not sleep in the home, they come in more intermittently and support them with skill building, bill paying, cleaning, that kind of thing. You can also have a mix of regional center funded staff and IHSS, which is not regional center funding, and self-determination dollars and private pay, any mixture of those. This is what I do for my 25-year-old son. I have this weird eclectic mix. And he lives basically in his own home with 24/7 staff, but we don't have supported living. We don't have a comprehensive care system. It's just sort of cobbled together. Now in this variant, regional centers pay for the services, but it depends. Some of the services, not all of the services. And housing itself is private pay, or you get a subsidy through Section 8, or what is called a set aside in a development. Sometimes you'll see an announcement, oh, a new low-income housing for adults with IDD. That's called a set aside in a new development. Next slide. And just quickly, 5 more. There are nonprofit owned communities where there are sometimes a cluster of apartments or a cluster of homes featuring various amenities where these people might live. Maybe there's 6, 7, 8, 9, 10, up to 20, 24 of them on a particular site, could be even more. Sweetwater Spectrum, Sunflower Hill, Camp Hill Communities, Casa de Ama in Southern California. These are just some examples. Services come from usually regional center funding or self-determination, but living in the home itself might be through a voucher, private pay, etc. Privately owned family LLCs. This is a strongly emerging form of housing where families get together and say, hey, let's buy an apartment complex, or let's build something for our kids. It might be, 4 families, might be 20 families. Some examples of this are the Peralta Apartments in Fremont, which was created by Friends of Children with Special Needs, Coastal Families in Santa Cruz, Mustang Court Commons in Petaluma. And again, all the services come from some mixture, regional center funding, private funding, IHSS, etc. And then in your own home, this is the most common variant, right? This is what happens by default, right? Someone continues to live in the home, but often the regional centers or other providers can provide some support. For example, independent living services, ILS, behavioral respite, a personal aid, IHSS, coordinated family supports, which is a new regional center program. And then a variant of that is having an ADU on your property, which is an accessory dwelling unit. If you build, for example, a dwelling unit in your garage, even you can convert your garage, or something like in your yard. Then your child might be awarded supported living, which is the 24/7 care in addition. And then finally, a 10th variant is after you're gone, a legacy home program. I'm sitting here in my own house, I die. Maybe what I do is I donate my home to Bay Area Housing Corporation, which is a disability housing provider. They're based in Los Gatos. They own many, 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 many dozens of homes. I donate it to them, and in return, they operate the home for my daughter and other people with IDD who might live with her. So those are 10 examples, I think, preeminent examples of disability housing. I hope that helps set the stage.
That was like a marathon run,
Yeah.
is what that was. I do have a quick follow-up just to that last question. And thank you
Yeah.
so much, Jill, for just endeavoring to go through that entire list. And also we've given her a microcosm of time. There will be another webinar that just talks about the types of housing later on this week. And we'd love to see you at that, where we talk about transitioning into housing, and we talk about the types of housing all throughout the rest of this week. And we, again, go to lsahomes.org to sign up for that. And we'd be happy to talk more about that. But just to follow up to this, Jill, you talked a lot about the regional center and that part that it plays in finding this forever home and the types of housing. I'd love to hear from you, Susan, now to kind of follow up on that and speak a little bit to how to navigate the regional center. That was a lot. And what if I, as a parent, don't even know where to start. There's a lot of resources that people try to get from the regional center. What are some of the things I need to know?
Well, I'd say the first thing is don't wait until you're 80 years old to decide that you need to find a place for your 60-year-old daughter to live. Start early, recognize that they deserve to have a life different than perhaps what they're living now. Start that process early because it could take a long time. Start having discussions with your San Andreas service coordinator, and even establish an IPP goal to explore housing options. Because once it's in that IPP document, that's a legal document and it won't get dropped off. So they'll have to talk about it at least annually if they live at home. And find out again, you know, if any of the, housing models that Jill talked about were appealing. Ask more questions from them, what that looks like, and how would you go about finding more information about that. If you think that residential care is something that is appealing for you and the person you're looking for housing for, then there's a document called the CDER, CDER, which stands for Client Development Evaluation Report. It's a document you get once a year, or you should. It's all a mystery what it really says because it's coded, but they don't give you a key code, so you don't really know what it means. But it's important that you're a participant in completing that CDER. Otherwise, the person that's filling that out is your San Andreas service coordinator, who in most cases doesn't know your son or daughter very well. But that CDER is what drives the levels. Granted, there's a lot of service coordinators that don't really stick to that, you know, following the CDER to determine a level. But that's really what's supposed to drive the level of support that an individual needs, is that CDER. So be a part of that. Tell the service coordinator that you'd like to sit in on that you want to be a part of that, and so that that document is accurate. And then establishing a level of home that could best support your son or daughter is important. It's really hard to, Dana and I always call it the 4F blur. But like Jill had mentioned earlier, the levels start out at level 2, then they go to 3, then they go from 4A to 4I. The higher up that alphabet, the more intense the supports are for someone to be successful. So I'll give you a quick example. We have 4C homes and 4F homes. 4C homes, the individuals that live in those homes, very independent. Many of them have jobs, they're scheduling their own transportation. A couple of them even drive. Very independent and really just rely on staff reminders to get things done. In our 4F homes, much different, much more support, mostly in the form of communication, some behavioral challenges, we call them easily redirectable. Maybe a lot of self-care supports needed, maybe not. That's where it turns into the level 4F blur, because we have people in those homes that are helping with their laundry, their meal preparation, and some that really are relying on staff for most of that. Even though we want everybody to participate at some level, even if it's just carrying their laundry basket to the laundry room. So establish a level. If you really would like to see a difference between a level 4C and a 4F, I'd be happy to give you a tour. We have a couple of homes that the people that live in those homes really like it when they get visitors. They like to show off their house, like to show off their room. And that would give you an idea of the type of individuals that live in a 4C home or a 4F home. And then you could go to your service coordinator and say, you know, I went and saw a level 4C home and I could see Jenny living in a 4C home really well. So just kind of give you an idea. Like I said, I'd be happy to give you a tour of both of those levels, so it might give you kind of an idea of what you'd like, or to chat a little more, and I can share offline what I know and could kind of guide you in that direction. That's it.
And speaking of offline, Susan, and all who are joining us, I know it might seem cruel that we're stuffing all this information in 30 minutes, but be relieved. We will have a transcript as well as more information available, particularly after this series and after these webinars are over, for you to comb through on your own time. One of the reasons why we've endeavored to do this webinar is because we're having these kind of conversations all the time here at LSA with various parents. But what we were finding is it's very hard to find very pointed, kind of almost like a library of discussions that are organized and the questions that you want answered around the clock. So we'll have that transcript of this talk, as well as some of the things that I've already gone over, that we've already gone over on our website. If you're interested, we already have a few different blogs that we've written on levels, the levels of homes, on our website. And you can find that right now, not right now, but after this talk, and do more research. And then Susan's already brought this up. We want to hear from you. We'd love to give you a tour. We'd love to answer and chat with you after this is over, and have conversations about your loved one. As Tina is always reminding me, if you know one person who has a loved one with IDD, you know one person who has a loved one with IDD. You do not all know all people. And for that reason, Tina, I want to ask you about your personal experience now. Thank you so much, Susan, for just kind of giving us these high level view of the homes. But I want to hear now from you, Tina, on your experience having a loved one in the home, and what that's been like, the transition's been like. How did you start that process? What were the steps like for you? And a lot of parents also ask, when will they be at a place where they're ready? How did you know you were ready? So can you talk us through a little bit of that, how you started the process, when you knew you were ready, and all those things?
Sure. I do want to reiterate what Susan says about doing your homework long before you need it. It's very important that you educate yourself and know all these options. And you already know your child, but you need to know what's out there. We started looking before Kevin was 22. I mean, we started educating ourselves sort of once he finished high school and was in a post-secondary program. Parents really are your best resource for me. Their parents have all the good advice. And so parents I knew or met through school programs, we would chat and, who's your neurologist or who's your ophthalmologist? But okay, now I'm thinking about housing. What do you think? And my husband and I, we just did not want to be in our 80s, as Hadia says. And I'd fall and break my hip and not able to care for my child, my adult son, who had never lived anywhere else, right? We wanted him to have his own place. And let's do the transition while he's young and while we are in good health, and move him when it's a good time, for everyone, as opposed to trying to do it in an emergency situation. And he's 30 years younger than us, and we're kind of old fogies, and the things that he wants to do are not necessarily the things that my husband and I want to do. And so the idea that he could have his own different life. And so we started conversations before we were ready to look for places, talking about having his own apartment or having his own room, and what kind of roommates do you think you would have? Now he would say Cinderella or Barbie or something, but you get the idea in there, getting it started. So since parents are your best resources, we sort of met together, a group of us. Again, it's before I was really ready. And we started researching and finding these different places. And we as a group, I mean, we did this over months. We would, as a group, go visit places, whether it was Camp Hill in Aptos or the Sweetwater Spectrum in Sonoma. And then we would, chat about what we saw and what we, were familiar with. when Kevin was turned 22 and was able at that point, to transition to another place, part of me, so we visited, Cyprus was about to open that year, and we were actually offered a place, to place Kevin in there, but we had only been seriously considering, placements for 3 months. And I wasn't ready. My husband and I certainly talked about that. Kevin probably could have done it, but it's like, we just really got serious 3 months ago. I don't think I can do this. And so we said no. And so what we decided at that point was we would spend the next however many years getting him ready. And we contacted the regional center. So it's important that your child is a client to the regional center, because they do most of the paying, whether it's supported living or in residential care homes. So they need to be a client. And we asked for independent living skills training. And so the Ability Path has people that would come into our home an hour or two a week and work with Kevin on doing his laundry, learning how to make a peanut butter sandwich. And we did that for 3 years, getting him ready. And then after some point, actually, we were offered a spot in Cyprus that something didn't work out, and they knew, they'd offered us years before. And the second time I jumped at the chance. It's like, you betcha. But the other thing that, me not being ready at that time was, we all have to come around to that place where someone else can take good care of our adult child. A lot of people think that no one can take as good a care of my child as I can. And that may be exactly true, but there are people, staff, organizations that can take really good care of your child. And that was the big step for us, is realizing some things are better in the new location. So, and then once they offered, we worked with Susan on an individual transition plan. So LSA knew us, and so I reached out and contacted our person, our person at SARC, and we had it in our IPP that our end goal was we wanted him to live separately from us, but we weren't quite ready yet. So we sort of gave them the green light and said, okay, we're interested. And they sent the packet over. And the way this works with residential care homes is the residential care homes have no say in whose packets they receive. The regional center sends it, but they do say who would be a good match for their program or their home, so they can review those. And so I asked, please send Kevin's packet. I think he's a good fit. And then LSA could review him and decide whether it was a good fit or not. And once it was decided he would move in, then there was a transition plan where we don't just drop him off the door and see you later. Or a period of weeks, I think it was at least 6 weeks, where he would go over every day after his day program, or like 1 day a week. And then it was 2 days a week. And then it got to be every day a week. And then it was, let's go spend all day Saturday. And so he spent more and more time in the house. He would, they asked, can you bring something that you would leave here? This is going to be your room. Can you bring some things that, you have, some of his plush animals or some clothes, or, we actually moved a twin bed in, and we had a small dresser. And so he had a place to hang with some of his stuff, a little bookcase, so he could have books. And it got more and more like home until the day of, when we moved him in. And, we went and visited him the next day. We dropped in to see how things were going. And now he's been there for over 7 years. And we see him a couple times a week. We pick him up from program and have him for dinner, and then take him back to Cyprus before bed. And then we have him for a sleepover occasionally on Fridays, where he sees us and we do that. So again, it was very individually planned, and it's what works for us and what works for our son. I will say we saw tremendous strides after we moved him in of his level of independence. It turns out I was more than willing to do things for him that he can do himself. And so that was delightful for us to see. And I do want to say one thing. Hadia has talked multiple times about a forever home, and I really want everyone to realize we hope Kevin can age in place and stay there for a very long time. But we're also aware that if there were something to happen, that he was no longer appropriate that program, we'd have to find a different place. We have won the lottery, and he's there and very happy. It's been great for years, but nothing's forever. And at some point, I'm not going to be able to live independently in my own home, and we'll have to do something. So it can be for a long time, but be aware that every 4 or 5 years, you should, evaluate how are things going? How are things working? So I'll hand it back to you, Hadia.
Thank you so much. And I'm glad that you said that because we're just at time for our Q&A session. And I just want to thank you. I hear people in the chat already saying it. Thank you so much, Tina, for sharing your story. But you brought up a very good point. And again, I wish we had more time, but I do want to open up the floor for questions. Some have come in now. And I want to encourage you, those who are listening, to ask your questions in the Q&A feature so that we can ask them. But you brought up a really good point. I want to make sure that I'm nailing this in. When I named this webinar series, a planning for or finding a forever home, it's very important that the disclaimer over all of this is there is no such thing as a forever home. And as Jill and Susan and Tina and I were prepping for this particular webinar, they reminded me that we are not sitting in a forever home, meaning all of us as a community, everyone is aging, things and situations change all the time. And so I don't want to be misleading, and I don't want LSA to come off as misleading when we say forever home. There is no such thing as a forever home. But there can be a really good, really good plan for a future that is long-term and not temporary. That does exist. And so that being said, I do want to hand it over to you all who are our audience, and thank each one of our panelists, Jill, Susan, and Tina, for all sharing their knowledge. And I want to also, I've put a couple of links in the chat already for a couple of people who have asked, just specifically wanting to know where I was referencing earlier with these levels, that are some light reading on levels. And I'm putting that there in the chat now for levels of homes. We also will have Jill's slide. I'm sure, Jill, you don't mind us sharing your slides with the people who join us here today on our website, right? Oh, you're on mute.
Sorry, maybe fix the font problem.
Yes,
but
yes, we will fix it. That's it. We'll fix the font and put it in a nice package. But we are going to leave this information. We've done this information for you. We had you in mind. That being said, we have a question that came up, and I want the audience to be able to hear the answer live. It says, which of these categories, and so I'm assuming this is for you, Jill, which of these categories would a family bought home belong? Where a family buys a home for their special needs and they live in it with 24/7 supports.
Yeah.
Can client child pay rent?
Go back to my slide, the middle slide, if you could. What, there, that one, just before. Go back one. Okay, there, thank you. So where would that fit? Good question. So, do you see here, it says number 5, a community home or apartment with regional center funded supports. That's where it would fit. So it's not a home, owned by an agency. It is, or it's a home owned by the family, or an apartment rented by the family, a townhouse, owned by the family, etc. It's your private property. That's where it belongs. And your question is, oh wait, the question just went away. Oh, here, answered. Okay. So can the client or child pay rent? Yes. So if you have one of these community homes I talked about here, you can see a couple of options in terms of paying rent or mortgage or whatever. Hold on, it's so low. I'm having a hard time seeing it. So you can private pay, for example, just out of your own pocket through your child's special needs trust or through your child's ABLE account. If you, again, like winning the lottery, if you have a Section 8 or a housing choice voucher from your local county housing authority, that can pay the vast majority of the rent. Similarly, there are these, in new developments, there are what are called set asides, and they'll set aside in many, many developments, some units for adults, low-income adults with IDD, and you will pay a very favorable rent. For example, you might pay $600 a month instead of $2,600 a month. So those are some of the options. Now, my own son, who's 25 and has very, very severe autism, is in one of these arrangements. I am in the property business. My property business owns a single family home in San Jose. He is the sole tenant of that home. He also has 24/7 care in that home. We call it a one-person group home. And so we private pay all the housing. We don't ask for any subsidy for that. But part of his 24/7 support is paid for by the regional center, and some of it is IHSS, and some of it is private pay.
Thank
Might
you
I
so
just
much.
add that LSA had entered into a model where a family purchased the home and leased it to us at a below market rate. And then we came in and set up the home and ran the home. And their son was able to move in, or could have moved in, but because of COVID, they changed their mind. So there's also that option. Little more, I don't know if it's risky, the word I'm looking for. Well, I guess you wouldn't, it's that below market rate that becomes the challenge. But we have done that before with a home in Morgan Hill that a family purchased.
And thank you for answering that. Susan, just following up, can you just briefly talk to us about the difference between us and what housing choices? I know that we don't coordinate with one another because we are two separate nonprofits. But can you talk about the difference between us two very briefly?
Between us and Housing Choices?
Housing choices, yes, that's right.
Well, Housing Choices, and I'm not the expert on this by any means, but they purchase homes and then find providers to operate them. And where we're purchasing our homes and we are the operator.
Owner operated.
Yeah.
Yeah, thank you so much. What about limited conservatorship? And anyone can answer this. Oh, it looks like Tina's already typing an answer.
Oh, that's all right. I'll go. I'll just answer verbally. Yeah, we conserved Kevin at 18, and so he remains conserved by us, and so that stays in place. Absolutely.
Yeah, I don't know of cases where the conservatorship is eliminated, except I have heard of like very rare cases where the conservatorship by the parent is contested by the regional center. And then in that case, they'd have to go to court. That's not something that happens automatically. They would have to go to court to reverse or undo the conservatorship. But that's only in cases where, the parent is maybe deemed unfit.
Yeah. There was a question that was asked about privately owned family formed LLCs. It sounds a lot like an intentional community, but it said two other parents wanted to start and do something like that. Is there a link for how to start number 7, which I think was yours?
Yeah. So I don't know if there's like a central website. Obviously, there are various videos on like the Autism Society SF Bay Area YouTube channel and probably elsewhere where founders of these communities have explained how they are developed, how they operate. I'd have to look up and find those links. We've always featured examples of those at the Autism Society conferences that we hold every year. But you can also just maybe go to the website for them, and then contact whoever their admins are.
I was also going to say, we're also going to talk to some people who have done that later on this week. And so you're welcome to join us for those webinars. We're specifically going to talk to some parents who have done just that. and see kind of, you know, how they got started. Again, each one is unique. And I would say a lot of the intentional communities or even, you know, group funded, family funded nonprofits that start like that for their loved ones, they're unique as the people who are going to be served in the homes. So I encourage you to join us for that. That's Wednesday and Friday. We have more people, founders, funders, parents who are joining us who've done just that. And I'm sure you're going to love to hear that conversation as well. Dana Hooper, he asked, how does Bay Area Housing Corp's legacy program work? Do they provide support as well as manage the home?
Yeah, so this is a brand new program. I don't think it right now it's more conceptual because I don't know if anybody's actually donated their home yet. But again, Bay Area Housing Corporation is a nonprofit based locally that owns, they're basically landlords, right? They own a lot of these homes that other operators come in and operate for those with IDD. And what they're trying to do now is serve these clients who aren't in group homes, but but they want their children to continue living in their homes after the parents die. And basically, you donate the home to the nonprofit. The nonprofit then, this is the idea at least, operates the home with your child living in it, but also adding another child. They would bill the regional center for the services that are provided. Does it mean that Bay Area Housing Corporation is actually providing the services? No, I think what they do is they contract that out. You know, they have to, deal with property management, right? They have to deal with obviously all the staffing issues. They have to deal with supervision, et cetera. So how exactly that would happen, I don't know. But I think that what they would do is make sure that it is happening in those homes.
Thank you so much. And I know that we already have addressed a few different things. And so thank you for really being grilled, answering all these questions. But I do want to talk a little bit, Susan, if you could speak to LSA's waiting list, because that got asked about that, what waiting list Tina joined in order to get into an LSA home, and how long is it?
Okay. So it's not really a waiting list. We call it an interest list. Waiting list would imply that if you're number 7, the 7th opening we have, you get to move in, where really you could be number 1 on that list and not move into an opening because it was either a level that wasn't compatible, or because after diving in a little deeper, meeting the person, them meeting the individuals that live in the home, it just isn't a good fit. So we look at our openings, we look at the people that live there, we look to find somebody that's going to be compatible. And it doesn't have to be the same age or things like this, but for sure we wouldn't want to put somebody in a home that is startled by loud noises and was someone who's very happy and loud all the time. I mean, so there's a lot of factors that go into deciding who's going to move into that home. So it's really an interest list instead of a waiting list. I encourage everybody to continue looking while they're on the interest list. I actually spoke to a woman 7 years ago whose son is going to be moving into one of our homes 7 years ago, but like Tina, she started the process early and then almost said yes, but then got nervous, and then almost said yes, but got nervous. And so finally, we kept her on the list. She said, "Don't take me off the list, just keep me on the list." So we called her again. She came out and we found the right home. She toured a couple of them that she just didn't think would be great for her son. 7 years later, she came out and met everybody living in this home, and they're going to be making that transition soon.
Wow.
Other times it happens quickly. Right now we have an opening in one of our homes. It's a co-ed home that has been open for a while, and I'm really surprised at that. But so you just can't ever tell. We do try to at least once a year make contact. If you email me and we're in contact and we get to, the more we get to know your son or daughter, the better we'll know if they would be a good fit for a particular home. And so we kind of pencil in, oh, this one would be a great fit at Tamarack, or maybe Humboldt would work for this individual. So it's hard to answer that question as far as how long does it take. Could be tomorrow, could be
But it
7
could be years. The other thing is
Right.
it could be
Yes.
years. So
Yeah, like I say, 7 years.
hopefully not 7, but yeah, it could be.
Yeah, but that was partially because the mom wasn't quite ready and was just looking for the perfect dynamics in the house and the perfect fit that was close to day program, and she finally found it.
Thank you so much. Susan, can you also, or Tina, can you also speak to the costs to come into an LSA home?
Well, there
Well,
is no cost to the family.
yep.
The Social Security, that typically someone would get every month goes towards that housing.
Yeah, I
Uh,
sign that over every month. I'm their representative payee, and I've got an account. I just send that to LSA every month. So we don't pay anything. Now, we happen to buy Kevin's clothes and we pay medical co-pays, but if we couldn't, LSA would, right? Or,
And they're allotted, I think it's $192 a month out of their SSI. That's to go for personal and incidentals. So somebody wants to go to a movie, somebody needs some new socks, somebody wants to go have pizza for lunch with their day program. And those are the funds that are intended to
They have
cover
spent
those
some
types
spending
of
money.
expenses. So there really is no cost to families.
And what about if the client pays any amount of rent, like the client decides to give, I don't know, they have a job maybe, and they decide to give $200 towards rent? Will that affect SSI or decrease the amount, or if the parent provides housing?
So the parent is providing the housing in their own home?
That's right.
I'm not positive, idea.
Jill, do you know?
Can you repeat the question?
Someone also wants to know, how does a housing choice affect SSI? For example, if
Oh.
a parent provides a housing,
Mhm.
does the SSI amount decrease? What if the parent pays any amount of rent or anything like that?
Well, if the child lives with you, you get the minimum. If they have a separate address, if you have an ADU with a separate address, that's considered a separate living situation and they would receive more SSI. I don't know about how much they pay, the rent part of it.
I
That
do know
part of
some
it.
people get more SSI than others. And in that case, they have a share of cost. So there are some guidelines, and the best one that can help figure that out with you would be your service coordinator in the financial department at San Andreas.
Yeah, SSI in the scheme of things is such a tiny drop in the water of the actual costs of caring for these individuals. I mean, caring for my son through the course of the year is in the hundreds of thousands of dollars. Yes, he gets SSI. Yes, I pay for, his clothes and et cetera with it, but it doesn't make a huge difference now. Not really.
I want to go to some of these questions that are being asked specifically, because a lot of them were dealing around cost. But somebody wants to know, when's the next autism conference coming up? That's you, Jill.
Yeah.
Well, good question. In our infinite wisdom, we had scheduled it for October 12th, which corresponded to the same October Saturday last year and the year before. Oops, that was Yom Kippur, which is a Jewish holiday. So now we have to change it. So hopefully we'll be able to do it in November, maybe even December this year. And
Okay.
we've held it every year for the past many years at Stanford.
And then another question that does come up often about, and I think this one can be posed to you, Susan, again, almost 20 years at LSA, but someone says that they've read often that there's abuses at homes, financial, physical, sexual, and what type of preventative measures are in place, if any, at various types of homes. I don't want us to speak on every home, but I'm hoping, especially as a program director, you can speak to what we do at LSA, especially financially and some of these other things to prevent abuse.
So that's a really good question, and it's a common concern for family members and for us, because there's always that possibility. First off, anyone that's hired in any residential care facility goes through a criminal record background clearance. And so if they've been arrested, they won't be working in the home. If they have a criminal record, won't be working in the home. And then when we start off with orientation, and this is also a requirement, we cover abuse and recognizing abuse and how to recognize it, how to report it. I think that financially, because we are in most cases managing the person's personal and incidental funds, we're required, and this is a regulation as well, so it's going to be consistent wherever you go if it's residential housing, that we maintain a ledger. We keep funds separately from everyone else's, so there's no commingling. We have to maintain an accurate balance in that ledger at all times, and provide receipts and have the residents sign that they indeed spent that money. LSA has other safeguards in place. For instance, if they're going to be making a purchase over $100, we want to make sure that there's a double signature on there, or that it gets approved, so that we're managing their funds or helping them manage their funds responsibly. We do audits regularly, where we'll just sit down, count the funds with two people to make sure that it's all accounted for and that there's receipts for everything. And then the other thing that we're required to do is maintain a list of the person's belongings. So if somebody has a CD player, we put that on their list of belongings, you know, the model number, the brand. Somebody has an iPhone, we list that on there. Somebody has a jacket, we list that on there. So all of their belongings are listed on their personal belongings inventory. And so we review that every quarter to make sure that everything that's on that list is still there. That even includes wheelchairs and dentures. So we make sure that that inventory matches what's really in the home. And then of course we have a theft and loss policy as well. So if something is missing, which doesn't happen as often as you might think. I mean, we might get a scare and, oh, we can't find Becky's iPad, and oh, and then we find out, well, maybe somebody put it in the cupboard or on top of the cupboard because Becky was throwing it and they just felt that it was safer there right then. So, you know, it doesn't happen like you might think, because there are a lot of safeguards in place. And I'm just a firm believer that people that get into this line of work do it because they enjoy it. They do it because they want to be doing it. They do it because they're compassionate and caring. And so the likelihood just isn't really there. But it is a common fear, and I can see why.
So we just have a few more minutes time, and I do want to make sure that we address one or two quick questions. I think this one, I'll give second to last one, I'll give to Jill, and then the very last one, I'll ask for both Tina and Susan. But I wanted to ask about undocumented families. Are services like these housing options choices, are they available to undocumented families, as far as you know?
Okay, so the issue here is becoming what they're usually talking about as a regional center client,
Oh, okay.
right? What are the rules around regional centers taking in undocumented families? That I do not know. There are other benefits, however, housing benefits, food benefits, that I know have, been provided to undocumented families outside of the regional center system. So, health benefits as well.
Sure.
So I don't know, other answers though.
Tina and Susan, you're shaking your head no. Tina, Susan, do you know?
I have
don't
no
know.
idea.
Okay. Never been asked that question before myself. So I didn't want to jump in and say anything that was wrong. Last questions, kind of grouping these together. Somebody's asked a lot about, a few different people have asked about the operation in the home, and someone thinks that special needs residents, residencies and these types of group homes may go away because it's too hard to find special need residents at the same level.
Oh,
Is
no,
that,
no, no, no.
that true?
I can't believe that would possibly be true. The need for housing far outstrips the availability. Now,
Okay.
we did see, a lot of homes closing over around the pandemic. You just not because of pandemic of that time frame, because it gets more expensive. But since the state did a rate increase a few years ago, things are looking a little better. But housing far outstrips the needs. Of housing availability the need for housing far outstrips the availability.
Yeah. And then to just follow that up, Susan, do you want to talk a little bit to this question that asks, it says, do you see care staff change often over the last 7 years, like 50% or more turnover rate, or the staff that you saw 7 years ago are now gone and there's a new crop of them that have turned over? Susan, what have you seen?
Well, I'll say this, many of our employees have been with us since LSA opened, have been there longer than I have. We do get some scragglers that come in. I think our turnover rate is 11%. So we do get some people that come in and, they think that it's a job that they can do, but then they soon realize it isn't, or we soon realize it's not a job they can do. But we have a great majority of our staff that have been there a long time. And so it's great because they can share their knowledge and expertise with people that come in that don't have experience. Since the pandemic, it's really been a struggle. I will say we've really struggled. And thank goodness for our long-term staff, because they're those coworkers that are doing double shifts or picking up an extra day, because they want to make sure that everybody is well taken care of, and that their supports don't change just because our staffing has.
That's right. That being said, we've kept you captive for an entire hour.
Oh,
And
Hadia?
yes, go ahead.
Somebody asked about an all-female group home.
Oh, that's right.
Yeah, and LSA actually has one. Maybe you could talk about that.
I was heading there next. Thank you so much, Jill. We do have interest list that is directly on our website right now. It's open. We have a new home that's opening this year. We're really excited about sometime this summer. Please do connect with us because we'd love to answer your questions. All female, we don't know. It may be could, we don't know. But we do have another home opening, and I know that there's a high likelihood that it could be all female. And so we encourage you to go to lsahomes.org and to join our interest list because it could be your loved one.
And we have 3 other homes that are all
That's
female.
right. And we have 3 other homes. And that being said, things do change all the time. And as we said before, there is no such thing as a forever home, but we can definitely plan for a future that is more permanent and less temporary, I should say. If we go to the next slide, that being said, I did want to invite you all to join us again for another talk on Wednesday. That's 3 to 4 p.m. You can scan that QR code, join us on lsahomes.org. We'll be talking a lot more about LSA, but then also other options that are out there. I do want to thank our panelists once again, Tina and Jill and Susan, for joining us. The conversation just when we were rehearsing this was so lively and welcoming and informative. I'm hoping you guys, everyone who's joined us today, got the same thing out of it. Join us for Home is Where the Heart Is. That's on May 18th. 2024 at the Campbell Community Center. We're going to be celebrating 22 years and we're going to enjoy ourselves. So come ask questions, but also enjoy the atmosphere and donate. Please don't be shy and help us to sustain for another 22 years. And in the next slide, I just want to again make mention, you can continue the conversation here with us at lsahomes.org. These are our socials. We're on X, formerly known as Twitter, Instagram, Facebook, and LinkedIn, all the major platforms, and we'd love to hear from you. Please do email us at info@lsahomes.org. The next slide, I do want to say thank you to our partner, SV at Home, who helped us put on these series of events for the next week for Affordable Housing Month, and we're excited to be partnering with this very important partner in the South Bay, as well as all the other organizations that have stepped up in order to provide some insight and help parents. This is their information. Thank you again for joining us today. We will have transcript and this video, as well as some slides available for you on our site later on. Please check back lsahomes.org and check your emails for a thank you. Thank you again so much for joining us, Susan, Jill,
Bye,
and
everybody.
Tina, and we'll see you on Wednesday. Bye-bye, everyone.
Bye.
Bye-bye.